Hi, this is Darryl Peterson with Micromeasurements. This afternoon, I'd like to show you a strain gauge installation on a tooth. And I've had the same dentist, Dr. Thomas Schaff, for the last almost 30 years. So, Dr. Schaff, this video is going to be dedicated to you and all that useful help that you provided over the years to keep my teeth in nice, clean working order. Now, the goal here is to simulate strain gauge installation on a tooth. And you might ask yourself, why would someone do that? Why would they put a gauge on a tooth? And well, the answer is a lot of times when you're doing research work related to composite fillings that they're using to repair your teeth, over the years they've installed gauges on it, and they would take the area, cut the cavity out of the tooth, and then pack it with that composite and cure it. And they can see what happens to the side of the teeth as that composite is cured. So what we're going to do is kind of simulate that with this little demonstration gauge on a tooth. And I'm going to put one of the micro measurements. This is a very small single grid strain gauge that we're going to install on one of these back molars. I forget what number it is. Dr. Schaff, don't hold that against me. But we're going to install the gauge back here on this tooth, and I'll just take you through the process of what that would look like. Okay? So let's go ahead and get started. So the first thing that we're going to do is we're going to take some of the micro measurements isopropyl alcohol, the GC6, and I'm going to take a gauze pad and just use that to clean off the side of the tooth. So what I'll do is take a gauze pad and just put a little bit of the isopropyl alcohol into the gauze pad and just come down and kind of work in and around the area and just try to degrease it. You know, from the molding process of making this demonstration, could be from somebody handling this little demonstration model, you know, whatever's gotten in contact with it, dust, that sort of thing. We're just trying to sort of clean that off. And in general, when you degrease, you kind of degrease a large area, even though the strain gauge is only going to take up a very small spot. So I kind of degrease that. And then what I'm going to do is take a piece of some silicon carbide paper. This is essentially wet dry sandpaper. I'm going to take about a 2-inch long piece of it and fold it in half like this. And then I'll take it and abrade right along the edge of that tooth. Now what I'm trying to do here is to introduce some texture to the side of this model of a tooth, because we need some texture for the adhesive to want to bite a hold to this plastic tooth model. So again, I'll abrade it back and forth. And what I'm trying to do, I'm trying to see if I'm getting it dull. You sort of want to take the shine off of it. And when you see that dullness, that's indicating that you've introduced some texture, which will be good for the adhesive to bite a hold of it. Okay? And then I'm going to take another gauze pad and a little bit more of the alcohol. And then I'll just wipe that off again. And since this is a plastic material, I'm not going to use the Imprep conditioner this time, the mild phosphoric acid. I'm going to skip past that step and go straight to the Imprep neutralizer. This is the ammonia-based solution. This will make sure the pH is at the right level. And also, this is an extra cleaning step to make sure that this is ready. So what I'm going to do, I'm going to go ahead and put some on the tip of the cotton tip applicator and go ahead and put some on the tooth, and then I'll just take it and kind of scrub it right along the side here in that spot where we're going to install the gauge. Okay, and once I'm happy with that, again, we're starting from a pretty clean surface. It's not like this tooth has been inside of somebody's mouth chomping on food for the last 53 years, but we'll get it nice and clean. And essentially at this point, we're ready to install the strain gauge. So just to review, we degreased it with the isopropyl alcohol. We did a light abrade using a 400 grit silicon carbide paper and then degreased it again with isopropyl alcohol, and then did a final scrub using the imprep neutralizer. Now the next step is we're going to take this model and slide it to the side, and we're going to locate our strain gauges. These are the EA06031DE120s. These are a very small linear strain gauge. And the first thing we need to do is go ahead and take them out of the packaging. So I'll just take one of the dental picks, chase it down along the edge of the seal, and pull that apart. By the way, when you're ordering strain gauges, if you have extras left over from a project, leave them sealed with the plastic sleeve. What that will make sure of is that they're as good as a brand new strain gauge. If you go ahead and take them out of the packaging, well, that packaging sort of serves as your control. So you don't want to remove that little plastic sleeve. Leave them sealed up until you're ready to use them. Now, on the package of strain gauges, we've got some technical data. We've got the resistance of the gauge. We've got the temperature coefficient of gauge factor. We've got the gauge factor for the gauge as well as the transverse sensitivity. Then we've got the polynomials for the thermal output. And then we've got some documentation for the foil lot as well as the work order. And then down here toward the bottom, we've got a little bit of ordering information. We've got the item code, the quantity in the package, which in this case is 5 gauges. We've got a date code for the manufacturing. Finally, the part number. And then, of course, we got this 2D barcode that has all of this information contained into 2D barcode. So if you had a 2D barcode reader, you could take that, shoot this barcode, and automatically import all that information into your software that you use to store strain gauge data. Now, so what I'm going to do is open it up, and I'm going to go ahead and take my gloves off. So I'm basically done with the surface cleaning. I'm going to take the gloves off, reach inside of the package, and take the gauges out. And make sure that you keep the package. Again, this is where you got all the technical data associated with the strain gauges. Is going to be on that package. So it's a good idea to take a picture of it. Do whatever you need to in order to be able to maintain that information so you can get to it when you need it, which is when you're ready to start putting this data into your data acquisition system. Now, I've just gotten a pair of the blunt nose tweezers. These blunt nose tweezers I'm going to use to handle the strain gauge, but I need to do a little bit of house cleaning first. So what I'm going to do is take another gauze pad and some of the neutralizer. I'm going to put the neutralizer into the gauze pad like this and take the tips of the tweezers and just clean them off, just like that. And then I'm also going to work here on this piece of glass. It's kind of hard to see in a camera, but I'm going to take a couple of drops of neutralizer and just wipe off this area. And this will be the area where I take the gauge, lay it out, and then put a piece of gauge installation tape over top of it. So in order to do that, we'll take the package, reach inside, take one of these gauges out. Sometimes when they've been in there a little while, they'll be a little sticky, so you just have to chase around it. You got a shiny side to the strain gauge. See how the tabs are kind of shiny? And I flip it upside down and you got a dull side. So with strain gauges, the dull side always goes down, the shiny side goes up. And if you look closely at this gauge, you'll see that it's got a very small grid in between the two tabs, and that grid is in line with the long direction on the strain gauge. So what I'm going to do is just take this folder, open it up like this, reach inside, grab the gauge like so, just like that. And I'm going to take it and lay it right there on my piece of glass. Now, the very next thing that I'm going to do is put a piece of gauge installation tape over top of this gauge so I can pick it up and I can move it. So this is a roll of the Micromeasurements PCT gauge installation tape. I'm going to tear off the first couple of inches of it and throw it away because sometimes it picks up a little bit of dust. And then I'm going to take a piece that's about 4 inches long, about like this. And I always like to fold the ends over. It gives me a little bit of a handle. I'm going to fold the ends over like that. And now I'm just going to take it, tack it down in place, wipe it over top of the strain gauge. And now I've got the strain gauge in place on this clean piece of glass, ready for me to pick it up and move it over to the tooth where we're going to install it. Now, before I do that, I'm going to take a razor blade, and I'm going to take the razor blade and I'm going to use that to trim the piece of tape, because when I look at this piece of tape and I look at the size of that tooth, it's really, the piece of tape is too wide. Several different ways you can do this. What I'm going to do is just come down along the edge and just try to chase that along the sides of the gauge. And just try to make this a little bit smaller. Make the tape a little smaller. I think it'll make it easier to pick it up and handle it. So I'll just take the extra pieces off. So now I've got a little thin strip of tape holding the gauge. And I think I'm also going to make them a little bit shorter too, because I got a limited amount of space to work with. So I think on this one end, I'm just going to trim it a little shorter, just so I'm not dealing with so much tape. And then basically you're at a point now where you want to lift the tape up. I know you can see that in the camera. I'm going to lift it up at a shallow angle. Once I get past the gauge, then I'll pick it on up. And I'm going to take it, I'm going to fold this end over again just so I don't have quite so much tape. I'm going to take the tooth, pull it over, and then try to get the gauge into the right spot. Let's see if I can show you that on the camera. There we go. We're trying to get that right on the side of the tooth, just like that. Now, if you look at it and you're not happy with the position of it, you pick it back up, you move it, and then reapply. And it gets a little bit tricky on something like this because you've got a very complex surface where you're trying to install the gauge. So I'll take it, push it down on there. And looking at that one, I'm pretty happy with that. So what I'm going to do is make sure the rest of this tape is held in place, because the idea here is that I'm going to lift it, exposing the bonding side of the strain gauge, but I want the rest of this tape to kind of stay in place on this next molar to help give me sort of an anchoring position for the tape. So now I've got the gauge. It's stuck on the side of the molar. Really, at this point, it's pretty simple. You need to find your adhesive. We're going to use the M-Bond 200, and that comes with the adhesive and the catalyst. We put the catalyst on first, and then we'll apply the adhesive system. The key with using this adhesive is that less catalyst is better. If you put too much on, you'll find it'll take too long for it to air dry. So I'm going to try to put as little catalyst on as possible, and then we'll apply a drop of the adhesive. We'll push everything back down and put some pressure on it. And your cure requirements for this is 1 minute of thumb pressure, and then you let it sit for 2 minutes, and then basically at that point you're done. So what I'm going to do is lift the tape. I'm going to peel it back, try to keep it in place. You can see I've got the gauge pulled back. And for this, we're going to apply the adhesive. And really, in this case, we're going to apply the catalyst only on the bonding side of the gauge. You see how I've kind of got it pulled back right now? I'm just going to take that and maybe tack it back over here. Try to see if I can get it to stay in place. There we go. Give the catalyst a little shake. Open it up. And this is the important part. Touch it on the inside part of the bottle 10 or 12 times just to put the vast majority of the catalyst right back in the bottle. You need very little of it. About 98% of what is in this bottle is a solvent, and we want to put most of that back inside the bottle. It's the 2%, that's the catalyst. And I'm going to take it and just use a single wipe on the bottom side of that gauge, maybe two, and now let it sit there and air dry. And this air dry time, you need a full 60 seconds. So again, you would start your watch. This is the part where you want to time yourself, because 60 seconds can be a long time if you're in a particularly precarious position where maybe you're laying on your back, or you're reaching up overhead or something like that. You really need to time yourself, because we need to give this a full 60 seconds for that solvent to air dry. Now, if you put it on and you can tell that it's blue, then that means that you need to wait a little bit longer. So typically, if I put it on and I can tell it's blue, I'm going to give it maybe 3 to 5 minutes of air drying time. So we've got the gauge basically ready. The tape is going to help to push this thing back down in the right position. We're going to put clamping pressure on it, which in this case is going to be our fingertip. And once we apply the adhesive, we need to move quickly. And we've got 1 minute of thumb pressure, and then normally we like to let it sit for 2 minutes, and then we can peel the tape off. Now right now I've just gone past my 1 minute. So what I'm going to do, since this is such an irregular surface, is I'm going to apply the adhesive onto the tooth itself. And then what I'll do is take the tape and pull it back over. So normally we apply the adhesive at the junction. I know you can't see that. We apply the adhesive at the junction of the tape. But this is such an irregular surface, I think that's going to be hard to do. So what I'm going to do is I'm going to put the adhesive on the back side of the gauge and then take it, pull it over, and push it down. Now, you're not going to need much. So what I'm going to do is take the cap off the adhesive. And I usually like to squeeze the first few drops of the adhesive out. Sometimes it sits there in like the neck of the bottle. And I just kind of want to get rid of that. And there's a couple of different ways that you can do this. A little trick that I like to use is, one of the things I'll do sometimes is I'll put a drop of adhesive out on the paper like that. And I'll take the handle end of a dental pick, scoop some up, take it, apply it onto the surface like that. And then I'm going to take this and pull it back over and push that down into place, and then make sure my thumb is over top of it. And it's really that simple and that easy. The key here is you got to move fast, because this adhesive wants to react and cure very quickly. So now we're back to 1 minute of pressure. So I've got the tape on it. I got about another 50 seconds to go. And we're waiting for that cyanoacrylate to react, kick over, and cure. And this is pretty similar to putting strain gauges on other types of materials. I think the biggest thing here is we did not use the conditioner in this case, because this is a piece of plastic, and I don't think in many cases that it's really necessary. The other side of this is we're using very small gauges, and we're putting them on the materials that are not very good heat sinks. So you really have to be careful when you start soldering to a small strain gauge like this, that you could potentially cause some damage. So a lot of times on an application like this, we like to use strain gauges that already have the lead wires pre-attached. In this case, we're just using one that doesn't. And I think I've just gotten to my 1 minute of pressure point. And sometimes, just like my finger is kind of stuck on the side, instead of just trying to pull it off, just take it and twist it, and it will release. And there we've got our strain gauge glued onto the side of the tooth. Now, the other thing that we want to do is we want to give it another 2 minutes. So we're going to let it sit here for 2 more minutes, and then we'll be ready to take the tape off of the strain gauge and start connecting the wires onto it. And you could use a dental pick to clean your teeth, right? Dental pick here you can kind of use to just kind of look along the edge. And I'm trying to see, did we get this gauge in about the right spot? I'm trying to lay it, it's kind of hard to tell in the camera, but I'm trying to lay it sort of horizontal along the surface of like this piece of paper. I think that's pretty close. So at this point, we're going to wait our 2 minutes, and then we'll take the tape off of the strain gauge, and then you're ready to connect the wires onto it. But this will be an example of installing a gauge on a tooth. This just happens to be a model. One of the first case studies that we obtained from one of the local universities was studying molar, where they had essentially drilled out for a cavity and packed it with composite filling, and one that cured in a single stage as opposed to multiple stages. I guess with the idea to try to make it a little easier on the patient that's waiting whenever they get a cavity filled. But they've had a lot of technology to come a long way in terms of dental repair work, and strain gauges have been a part of that over the past 30 years, at least as long as I've been involved. Both strain gauges and photoelasticity have been used in the study of dental work and dental implants and composite fillings and other similar types of applications. Okay, so we're at a point now where we can go ahead and take the tape off. So I'm going to just start it at this other end. I'll just take it and kind of peel it back. And as we kind of peel it across, we'll just take it on up. And there's our gauge mounted on the molar. And at this point, we would do an optical inspection, and then we'll get ready to put some wires on it. Thank you for taking the afternoon to watch this video.